Hello. Imagine one morning you wake up with a cold and you want to go ahead and go to the doctor. You try to call and make an appointment, but the receptionist informs you that the doctor can't see you until the following week. You're annoyed and there's nothing you can do to change this. There is a reason why your doctor can't see you any sooner, which is what I'll be discussing today. Today I will inform you on the basic concepts of universal healthcare coverage and some of the concerns that arise with it. I have read several articles on the internet, listened to media coverage on this issue on the news, and I have watched a video online to help me understand the new Healthcare Reform Act better. Today I'm going to discuss why many think our current healthcare system needs to be changed, what the health administrators have come up with as far as how they want to change the system for the better, what exactly the new Healthcare Reform Act entails, and some of the main concerns with progressing with this new Reform Act. So now let's get started. I will begin by talking about our current healthcare system as it is today. Why change our current healthcare system? What's wrong with the way everything is now? First of all, our current healthcare system has a few flaws that are affecting the entire nation. 1 in 7 people are said to not have health insurance. People can be turned down if they have pre-existing health conditions such as asthma. Over the past few years, our premiums have even doubled, and health care coverage is not affordable to everyone. These facts can be found with the Henry J. Kaiser Family Foundation. Healthcare administrators have worked hard to try and solve all these problems. They have created 2 phases within the new Healthcare Reform Act to help solve these problems. But first, let's take a look at what the new Healthcare Reform Act really is. On March 23, 2010, the Affordable Care Act was signed by President Obama, and this is what put the new Healthcare Reform Act into place. To break universal health care down into simple key points, it will look like this. Less people will be turned down from getting health insurance. There will be less holes in the system. More people will have insurance, and by 2019, 32 million people have been predicted to have health care coverage, and 23 million will still not have it, but that number mostly consists of undocumented immigrants. Now let me back up. Like I mentioned earlier, the solution to our current healthcare insurance problems have been put into 2 phases. Let's look at what Phase 1 consists of. Phase 1, which is taking place between now and 2014, consists of many changes within our healthcare system. Insurers will be limited on how they spend our premium dollars. Some services will eventually become free. People on Medicare will be getting more help with their drug costs. Young adults will be able to stay on their parents' policies until age 26. Some businesses will get tax breaks to help pay insurance for their employees. Lifetime limits on health care will no longer be available. It will be illegal to turn kids away even if they have pre-existing health conditions. Adults who are rejected will be able to enter the high-risk pool, which is a government-run policy. Most of these changes will be taking place in 2014. These facts are available with the Kaiser Foundation and the U.S. Department of Health and Human Services. Now you might be wondering what happens after 2014. That is when Phase 2 will take place. Phase 2 of the Healthcare Reform Act starts New Year's Day 2014 and consists of changes that will take place between then and into the future. Medicaid will be expanded to help all low-income families in every state. If you lose your job or your job doesn't offer good insurance rates, you will be given a health insurance tax credit. Most people will continue to get insurance the same as they do now, but if you don't, you can buy what's called an exchange, which is paperwork based on your state that gives you all the different choices of health insurance and all the different insurance rates. Insurers will no longer be able to turn people down or charge money if you're sick. If businesses do not insure workers, they will be forced to pay large fines. And if people do not purchase insurance policies, they will be forced to pay large taxes. These facts were found at the U.S. Department of Health and Human Services website in the Kaiser Family Foundation video. With any new changes to healthcare, you can be sure it's going to cost lots of money. Let's take a look at the cost and how it will be paid for. First off, the Healthcare Reform Act is going to cost the nation $938 billion over the next 10 years. Medicare is going to run several tests and experiments on how to effectively pay our physicians. People who get higher wages will be forced to pay higher Medicare taxes. Fees the government pays for hospital care will no longer be allowed to increase. Insurance companies that provide Medicare will be paid less. Companies that make medical devices and drugs will also be paid less. And people who go to tanning beds will be forced to pay taxes. This is intended to help save our country $124 billion over the next 10 years. These facts were available at the U.S. Department of Health and Human Services website in the Kaiser Family Foundation video. So far, I have listed ways in which our government believes to solve our health care problems and costs of health care, but I have yet to mention what our doctors have to say about this new Reform Act. One of the main concerns that most physicians in the nation have with the new Healthcare Reform Act is Medicare. If Medicare is expanded to every individual, how will it affect hospitals? That is something hospitals have yet to fully understand. Some physicians and health administrators believe this could lead to a financial disaster within healthcare. Currently, hospitals are paying more for Medicare patients than they are actually being reimbursed. This is leading to hospital debt. The state will receive federal funding for expansion, but it is unclear where that money will go. These facts were found at the Norwalk Citizen, which is an online newspaper. Another concern physicians have with the new Reform Act is the congestion that could be caused. In 2010, the Association of American Medical Colleges put out a statistic that stated there is a shortage of 13,700 physicians. Then they predicted that in 2015, that shortage would increase to 62,900 physicians, and by 2020, that shortage will have reached the high of 91,500 physicians. The healthcare system is already congested, and if these shortages continue to increase like they have been predicted to do, congestion is believed to increase as well. Because of the shortage of physicians, just because you have insurance does not ensure that you will be able to see a doctor or be able to make a doctor's appointment. These facts were found at the Norwalk Citizen. This concludes my information on the new Healthcare Reform Act. I hope that after hearing this information, you will better understand the problems with our current healthcare system, the solutions that have been put into place to help install the new Healthcare Reform Act, and I hope you understand some of the concerns that follow with this new Reform Act. The nation is split on this topic because there are many different pros and cons that come along with the Reform Act. Some even believe that this Reform Act is unconstitutional because it will be forcing everyone to eventually buy insurance policies. No matter where you take your stand on this topic, I hope you better understand the importance of your health insurance and what you're doing as far as spending to get it. These facts were available to me by the internet, the U.S. Department of Health and Human Services website, the Norwalk Citizen, an online newspaper, and the video on the internet put up by the Henry J. Kaiser Family Foundation. Now, take a look at my poster. I broke down the Reform Act into two phases. There are many more things that consist of phase 1 and phase 2, but these are the major things. And then, on the back, I have how we pay for it. And once again, these are just the major ways of how our health administrators have put into plan how we can save money, and we're supposed to be able to save $124 million over the next 10 years out of the $938 billion cost that it's supposed to be costing us.